Friends, today we'll look at why hands go numb, when you feel the need to move them or relax them, or if specific fingers or the whole hand and wrist go numb. We'll try to figure this out and do a specific set of exercises. The first thing we, as physical therapists, pay attention to is our neck. Since each spinal segment is responsible for its own innervation, the neck innervates the upper limb. So if we have problems here, we will feel some discomfort in the arm and in the shoulder. The first muscles that cause such numbness run along the front surface from the neck and attach here under the collarbone. When they are spasmed, they will accordingly compress the main nerve that runs from the base of the neck through the collarbone and goes all the way to the hand. To relax it, we'll do a simple exercise. I put my hand behind my back, tilt my head to the opposite side. My task is to pull the shoulder down as much as possible and pull the head to the other side. I take a deep, calming breath in and slowly stretch myself out, then exhale. Inhale, pull the shoulder down, lower the head, exhale. I should be comfortable. I won't make any sudden movements in the neck. Take a breath in and stretch calmly. Exhale. Inhale. Exhale. We do 15 to 20 repetitions of these. At the end, when you feel that your muscles have become warmer and more elastic, we can help ourselves with our hand. I'll pull with my hand, I'll exhale, and one last time, exhale and hold. Good. My recommendation, if you feel numbness in one hand, tingling, and the symptoms are always on one side, do it on both anyway. Start with the one that is the more noticeable, painful side, and always finish the other side consistently. Good, and let's continue. My head is to the left side, hand behind the back. Inhale, pull the shoulder down, lower the ear, exhale. Inhale, stretching. And exhale slowly, inhale deeply, and then exhale gently. Relax and breathe out. Even at this moment, you might feel a slight tingling in your fingers, a bit of numbness. If the discomfort doesn't increase, then it's fine. Exhale. Let's do it one last time. Exhale. And I'll pull further with my hand. Hold this for 10 seconds. Good. If we've warmed up the upper part a bit, we need to work on the collarbone area. When our shoulders are rolled forward under the collarbone, these muscles are tense, and accordingly, they will also irritate. There's also a lymphatic bundle here that's responsible for the blood supply to the arm, and they'll also disrupt innervation. So we'll do a simple exercise like this, working on the shoulder muscle. I'm sitting straight, my back is straight, looking straight ahead. The goal is to raise your straight arm up, exhale, and relax, inhale, exhale, and inhale. All the exercises we'll do today can be performed using just your body weight. Once you adapt and are ready to progress, use resistance bands for counter resistance. Attach the band at the bottom and move your arm upwards. Inhale, exhale, inhale, exhale, inhale, exhale. My goal is not to raise the shoulder as the arm goes up. Shoulder down, shoulder blade stabilized. I inhale and raise, then exhale. Same for the other arm. My position is stable, thumb pointing up, shoulder down, shoulder blade fixed, and exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, and 4 more like this. 3, 2, and 1 last exhale. Good. One more important point. We need to open the chest, stretching the pectoral muscles that pull our shoulders forward. I need to find an opening like this, where there's a doorway. The goal is place your arm with the elbow. At shoulder level, I stand, take a step forward, and turn slightly away. You should feel a comfortable stretch from the arm all the way to the chest. Exhale slowly, hold for 10 seconds. Then you can gently return to your starting position. Inhale deeply and exhale again while maintaining that stretch. Inhale gently and step forward, moving to the opposite side, and then exhale slowly. Inhale and exhale. Good. We do 10 to 15 repetitions and switch. My other arm, the same position. Lean in, elbow at shoulder level. Take a step forward and turn to the opposite side. Exhale. Inhale. And exhale slowly, fully, and gently stretch. Take a moment and pause. Inhale. Exhale. Inhale. And let's do 2 more last ones. Exhale. Inhale. Exhale. Good. Friends, I hope this was useful for you. Give us a like and subscribe to our channel. And if you need professional help, please reach out for a consultation with our center's specialists. We're in Ukraine, Warsaw, and Dubai. And a convenient booking link is in the profile bio or below the video.